Thank you so much for inviting me to come and tell you about our work at UCL, where we're trying to develop effective treatments for dementia. Dementia is a global health challenge. WHO last year made predictions that by 2025, 75 million people worldwide would be affected by dementia. They predicted that there would be 10 million new cases every year. And that's a new case every 3.2 seconds, which means by the time I finish this short talk, 150 people will have developed dementia. And dementia is not just a natural part of aging. It is a disease, and Alzheimer's disease is the commonest dementia. Millions of pounds have been spent on failed drug trials for dementia. So why have they failed? The reasons are complex, but mainly the drugs didn't work, the drugs didn't hit their target, or people were not treated early enough. So I look after patients and families with Huntington's disease. And this is Kim, who's one of my patients, who was very happy for me to show you this video when I saw her recently. Huntington's disease, many people may not be aware, is actually a dementia. It's a genetic dementia. It's the commonest genetic dementia. And you can also see in this video that it happens to also cause involuntary movements. I'm going to tell you about how our work in a genetic dementia like Huntington's disease may help unlock treatments for the other more common dementias like Alzheimer's disease. We're made from genes which make a message, which make proteins, which make us us. In the case of Huntington's disease, people inherit the Huntington's disease gene, which makes the Huntington's disease message, which makes the Huntington's disease protein, which causes all the damage in the brain. If you don't inherit the gene, you don't develop the disease. And here, it's a cell culture dish, and these are nerve cells or neurons in the cell culture dish. And the green clumps are clumps of the aggregated Huntington protein. It's the toxic protein, and it's killing nerve cells. And these aggregated clumps of protein that kill nerve cells occur in all forms of dementia and neurodegenerative diseases. And actually, another name for these diseases is protein misfolding diseases, because they're caused by toxic lumps of protein which clog up the brain. And here is a video, it's a film, an MRI scan of a pre-symptomatic Huntington's disease gene carrier. So this is a patient of mine, and this person is 15 years before they are predicted to develop the disease. And we can make some predictions about when people will develop the disease based on understanding their genetics. So this is 15 years before this person is expected to show signs of the disease. And the scans are 2008, 9, 10, 11, and 12, because we studied the person over a number of years. And you can clearly see 15 years before they're expected to show signs of the disease, their brain is already changing. And we think and have evidence for that a similar process is occurring in all other forms of dementia and neurodegenerative diseases. So the lifetime of a Huntington's disease mutation carrier. Someone's born with the abnormal gene, they're completely well until they develop the disease. The average age of developing the disease is about 40. They're born with healthy brain cells that then malfunction and die. And there's two important things to take home from here. We have a 100% sensitive genetic test, which allows us to identify people many years before disease onset, and people with very early disease. And that's predictive genetic testing. So many people choose to find out if they are going to develop Huntington's disease in the future. And the other important thing is that we can identify people many years before onset, which gives us this golden window of opportunity for the potential to treat early to prevent this disease. So how are we going to treat Huntington's disease? It's a genetic dementia. And we're going to do this through a technique called gene silencing. This is enormously exciting genetic therapies for brain diseases. I told you about you have a gene which codes a message which makes the protein. We're going to switch off the level of the message to reduce the level of the toxic protein. That's gene silencing. And we're doing this through a chemistry called antisense oligonucleotides. So this is double-stranded DNA. And Huntington RX is a single strand of chemically modified DNA that binds to the Huntington message and will switch off the toxic protein. And this is a collaboration between UCL, Ionis Pharmaceuticals. We're giving the drug directly into the spinal fluid, where it travels up to target the brain to switch off the toxic protein. So we're targeting the brain directly. We started the trial last year, and we've successfully dosed several patients with Huntington's disease. And we're working hard to take this forward as a potential future treatment for all patients with Huntington's disease. So back to the schematic of the lifetime of a Huntington's disease mutation carrier. Eventually, we want to be able to treat people when they're young, when they're 18 years old, to prevent the disease ever occurring. And why is prevention so important? Because if we can treat early, we can treat it before the brain damage occurs and maintain a good quality of life. So why is this important for other dementias like Alzheimer's disease? I mentioned that they have a similar cause with protein misfolding. But if we can slow or reverse the brain damage and neurodegeneration in an inherited genetic dementia like Huntington's disease, where we know the cause, then that means these brain diseases are potentially treatable and reversible. And that has huge implications for diseases like Alzheimer's disease. So prevention is absolutely key to treating these diseases. So Alzheimer's USA has calculated that if you could delay the onset of Alzheimer's disease by just 5 years, by 2025, you'd reduce the prevalence by 42%. So millions of people would not be affected. And that's what we're doing and working towards. So at UCL and the National Hospital for Neurology, we're working very hard to find effective disease-modifying therapies for all forms of dementia. And if we can slow or reverse brain degeneration, then that's a massive game changer for all dementia and brain diseases. And this gives enormous hope for the future, not just for people like you and I, who are all affected in some way by dementia, but for future generations to come. Thank you.